she told me to make up monthly follow-up visits for the insurance to document my weight, dieting efforts, because they require a 6-month diet. Well, little did she know I'd already called the insurance and asked them if I could use the diets I've been on in the past from my previous doctor, and she said yeah, as long as they're in the same medical group, which it was, and I provided them with records I had copied for them for the chart. So I brought all my old doctor records for them, at least the ones that actually wrote something in it, not just one of those here today, gone tomorrow kind of thing. I met with the couple medical assistants that worked there and did paperwork and stuff. My BMI then was 44. I returned on my monthly appointment in June and found out that there was still nothing submitted for the bariatric surgeon referral. So I requested it again, and she said she would, the receptionist said she would send it. My BMI then was 45. I went back the next month, July. And still, there was no bariatric surgeon referral submitted. 2 months. And I requested they sent it again. And at that time I had an x-ray of my back, and my BMI then was 46. Went back the next month in August and found out that it's still, the bariatric surgery referral still had not been submitted. Thinking, what's going on, you know? So I requested they submit it again. My BMI then was 47. The next day I called them up and said, you know, what's going on with this bariatric surgery referral, and she said she sent it in and to wait 2 weeks to hear a response from the medical group. You know, I was really on my dates, as you can tell. After the 2 weeks, I called the medical group, and they informed me that they never received anything from my doctor's office, which is the usual story from them, so I'm not sure who's at fault here. So I called my doctor's office again, spoke with the receptionist, and requested they send the bariatric surgery referral again. And then it just wasn't progressing anywhere, so on September 14th I wrote them a letter. I wrote my doctor's office a letter expressing my concern regarding the referral that had not been submitted, even though they told me they would. In May they told me they would, you know, and here it is September, what's going on? That I was hearing that it had not been submitted yet, and I said, like, why I felt the procedure was medically necessary, like BMI, comorbids, etc., diets in the past, and I had attached a copy of this when I submitted my appeal and my IMR. I also received a letter in the mail dated on this date from the medical group that supposedly hadn't gotten anything, but now supposedly they did. So I don't know who's saying what, but anyway, they said that we cannot make a decision at this time based on such and such Apollo criteria, whatever, consultation referrals. A patient must be referred to a specialist only if the service she needs cannot be provided by her primary care physician, and if she needs treatment that a specialist is trained to provide. Our medical director would like to ask a copy of your records that should include medical history, exam findings, all workup done to date, and your response to treatments received to support the medical need of a consultation. Then they gave me a date to do it. So I was calling my doctor's office every day saying, look, I gotta get this done, or it's, you know, X day on the referral, you know. They asked her to fax all the required information, and she did, and I had an appointment on the 15th of September, and then, you know, they requested the pain management because it wasn't getting better. And that's when I handed the doctor's office a letter, you know, asking her to please send the referral again, because I still thought it hadn't been submitted or received or who knows what at that time. And I went back again on the 20th, because I had been in the ER, and I guess I had a reaction to the fentanyl patch that they had put me on for the pain. That wasn't fun. I also, went in trying to say, hey, maybe they can figure out what's wrong with my back, because, still, no one has told me what's wrong with my back. Only by requesting these medical records have I found out. I think I talked about it in the pain management video, what I found out. Just like a little comment above my head on one of them. But there is like disc bulge and degeneration of the back. And now it's pretty obvious that there's something going on because there's paralysis in my leg, and now it's getting really bad. Like, I can't lift my leg up on the couch, kind of bad. I couldn't get it in the shower before, but if I kind of plop myself on the couch, so to speak, I usually could lift it up halfway and then yank it, but now I can't even lift it up, like, but a few inches off the ground, or maybe 2, and I'm using like all my might just to do that, and it's horrible. It's like that most of the time, and no one's really wanted to put me on anything but narcotic meds, and I don't want to be on narcotic meds. I have families that were addicts, and I don't want to be an addict. And narcotic meds just kind of make you feel tired and sick all the time. Who wants to do that, I'd rather be in pain than feel sick and tired all the time. It's kind of the same thing. But, right now I just take the NSAIDs, which seem to help the arthritis in my hip. Like, my hip, I can't, like, the range of motion isn't very good. I can't, like, it's going to be looking pretty bad, so choose your eyes, children. But I can't, like, open like this very well. Like, if I'm sitting, I can't get in the car. It'll hurt all the way down my legs, so I don't know if the sciatica is from that as well. I don't know, it's just like the whole hip joint and my butt. Am I allowed to say that? My butt. All the way down to like my toes. Like last night, it was so horrible. And so I'm really hoping I can get into that pain management clinic soon, as I talk about in that video, which I'll upload soon. It's all ready to go. But I wanted to talk about this first. Just, things in order. Anyways, on September 20th, I don't know what a scepter sounds like a weapon. September 20th of last year, I went in and, I asked for a wheelchair, because I couldn't even walk at that time, so my husband had to go in the hospital, get the wheelchair and bring it out, shove me in it, and then put me in there, and that time was just awful. Like, I went to the hospital 3 times in a week. Not in a week, but like in a month. And it was the same doctor, and every time it was lose weight, here's a Percocet, go home, lose weight. I don't want no Percocet. I was on the Venmo patch for, don't give me a Percocet. I just want an MRI. I want to know what's wrong. It's this kind. And finally at the 3rd one, he's like, okay, we'll try. And, it was just awful. I couldn't even fit in the MRI. All I could get in there was, here up. These things didn't want to fit in there, and neither did the rest of me. And the guy's just like, suck it in. You can do it. I'm like, I am not going to get squished into this tiny freaking MRI machine. No way. I'm not doing it. So they tried a CT scan, and whew, when they inject you with that iodine, you feel like you're having a heart attack, man. That was some trippy stuff. I was just like, I'm dying. Poor people there, but that's when they showed the disc bulge. But they told me nothing showed up. But I asked for a copy of the record anyway, and I saw, disc bulge. I'm like, huh? How come they're not telling you that? And they were just kind of, lose weight. It was a bunch of baloney. BMI at that time was 46. On October of last year, I called once again to see if they received anything. Or no, I called the, ow, squirt bit me. I called the medical group to see if they received anything from my doctor's office regarding the referral, and found out I was approved to see a bariatric surgeon. And I went to my monthly follow-up visit with my primary care and found out that the nurse practitioner, or the physician assistant I was seeing, no longer was there. And lo and behold, the doctor from the old place that I went to, who refused me for bariatric surgery, is suddenly the only doctor there in the practice. At this point, I didn't feel like I should change my doctor because, I had all this evidence of diets and everything, and the whole time I was there, I was on the diet too. I was just like, oh man, not again, but he was concerned for my health, and I told him that she had written the bariatric surgeon referral, because it's just kind of like, what do you need? And he agreed to refer me as well, uphold the referral, so to speak. He agreed that this was the most appropriate thing for me. He also requested that I see an endocrinologist at that time. BMI was still 46.